So we're going to kick off, first of all, with a practical example from West Wales of digital working, digital collaboration in practice. It's a project called the Health Cloud, which is described in the delegate literature, as a trailblazing collaboration that is led by Swansea University. And three speakers are going to tell us about the project. They're sitting down here, I guess. Can I welcome up here James Zorab, followed by Kevin Curtis and Rob Garlick. Thanks very much.
Okay. Good afternoon. My name is Rob Garlick, and I'm from the College of Medicine at Swansea University. I'm here with my colleagues today to represent a Welsh government-funded project known as the Health Cloud. And I've been given the challenge today to try and break down what that project means in under 8 minutes. So it's going to be a bit of a tight squeeze, and I'm sorry if it's a brief overview. First of all, a bit of the background about the department I'm working in. I work alongside the eHealth Industries Innovation Centre. Some of you may know that as EHI2 if you've worked with us in the past. And it's a department within the college that's dedicated to the development and assistance of digital SMEs within the healthcare sector. And our specialty is finding innovative solutions to problems which affect the development of the eHealth industry. For quite some time now, we've been aware of a major gap in the market which companies are struggling to utilise. Our research has suggested that there is in fact a major demand for specialist software products within the NHS. And on the left here we can see some examples, but I will stress that these are just a few examples and there are many more. Equally, there are plenty of companies that we're aware of with the development skills and products to meet these demands. Some of whom are probably represented here today. But what we've often found in the past is that it's almost impossible for people to penetrate the NHS market. Data security restrictions rarely allow sensitive data outside of the secure environment within the NHS. Even then, information governance regulations rarely allow third-party companies to handle sensitive patient data. This leaves the NHS with only one option, which is to purchase products directly. However, the problem here is that purchasing software products from the NHS is often a complex and lengthy process. And in this environment, small companies tend to find it impossible to compete with the bigger brands. We're talking a process of about 18 months on average just to sell one product. So what we're often seeing as a result is a lot of great ideas going to waste because they're never given the chance to prove their value. It's basically a lack of trust between the NHS and companies. What we believe is that there is a solution to this problem. And over the last few months, my colleagues and I have been working to make it a reality. We are creating a secure software platform which will actually occupy part of the NHS network. And what we're going to do then is bring applications into the network. And this is really the key concept of the cloud. Because if you bring applications into the network rather than keeping them on the outside, data never has to leave. All the analysis that's done by various applications that companies have provided is done on the NHS network. Equally, our approach is mindful of the information governance rules within the NHS. All applications analyse data instantly, meaning that data isn't saved, isn't stored, and most importantly, it doesn't go back to the company. Everything is done on this platform, and results go directly back to the customer. Furthermore, our approach helps companies avoid lengthy procurement procedures, which have been holding them back in the past. Instead of purchasing entire software packages, clinicians who are paying for these products are just simply paying on a pay-for-use basis for the information that they're analysing. So you pay for one answer, and then you get it back. So with these microtransactions, it slips under the procurement system because it's only very small amounts of money that are being dealt with. In a sense, it's almost like an app store on the NHS, but without actually downloading applications, you're just downloading clinical data. Our hope is that, once created, the Health Cloud will act as a bridge between a receptive market and a full range of e-health products which are available, and there are plenty of them out there. Most importantly, it creates the environment of trust that is currently missing. The cloud will give clinicians the confidence to purchase the products they need, and it will allow them to try different products that they, want to try out, things that they're not so sure of, maybe they want to compare with other products. Fundamentally, though, the cloud will also give clinicians a unique opportunity to share their ideas for future products with industry experts. And what we've created there is an innovation forum. Because clinicians are actually in contact with the industry experts, they can tell them what they need, and then the industry can provide it. This link definitely helps companies because you can identify future markets well ahead of your competitors if you're involved in the cloud. The university is, of course, very proud to lead this project and bring about the solution. Our key advantage in this is the strong working relationship that we have with the NHS, and that is why the project is fully endorsed by the NHS Wales Informatics Service. And once we've got them on board, that's all of Wales conquered. So I could probably summarise the objectives of the project as follows. First and foremost, our main intention is to give companies a fair chance by creating a trusted link with the health service. Very keen to cut through the barriers which are stopping the Welsh e-health industry and the NHS from becoming strong and successful business partners. Another objective is to provide the NHS with an easy, safe way to utilise a whole range of healthcare application tools. We're very keen to contribute positively towards greater efficiency, cost saving and improved patient outcomes within the health service. And furthermore, we have the ambitious aim of making the cloud a permanent service across the UK, so these benefits will be available to everyone in the UK. So far, we've had a fair bit of success in doing this. For one, there's been a very positive level of input from NWIS, and I said they were fully cooperating on the project, but it's very difficult to get them to be positive about anything sometimes. So far, the NHS has put in a great deal of time and effort to help us make the Health Cloud a reality. And given the levels of cooperation and enthusiasm we've received from them, we're expecting future collaboration from them for some time to come. We've also had a great deal of interest shown from digital SMEs who want to be a part of the cloud. The reason none of you, well, probably not many of you have heard of the project so far is we've actually had a relatively quiet marketing campaign for it. Despite this, largely it's been through word of mouth. We've managed to get a lot of companies on for our first phase who are currently awaiting installation with us. There's also been a great response amongst NHS clinicians. And we've managed to successfully recruit a large number of test clients for the cloud's pilot phase. Starting in November, the cloud will become operational and will be tried out by our community of clinical testers. From then onwards, we'll be working tirelessly to make the cloud a household name within the NHS. The rest of the project is basically focused upon building a strong, permanent bridge of trust between a massive healthcare market and the companies who join us. And on that note, I would like to now pass on to my colleague, James Zorab, who will demonstrate how he's participated with and benefited from the project, followed by Kevin.
Well, hello everybody. I'm James Zorab, and I'm the CEO of the Ascent Group, which has developed Codel, which is a digital notary. And a digital notary is a service that creates digital fingerprints of data and stores them in a searchable registry 24/7, so that if you share content between two parties or multiple parties, they can verify it and know that it is good. Has loads and loads of applications. We provide this searchable facility. We've got a trusted location in London that's mirrored in other multiple locations. And the reason we developed this, the need for Codel, was because as analog processes migrate to electronic, they need to be durable and provable. And so the existing techniques for proving electronic data are not particularly well developed, and they're very complicated. So we heard about the project, and I've tried here to give you a rough idea of what it looks like in a schematic. So you've got the applications sitting inside the cloud, and you've got people who might use those applications on the outside. And the reason that we wanted to collaborate in the project, it was twofold, really. The first is we've got some subsidiary applications which we think are necessary and that people will use. One of which is a telematics application where patients would be able to have teleconferences with their doctor. And in that environment, you're going to need durability of the information that travels between you and your doctor. So that would be an application for Codel that could sit inside the App Store, as Rob described it. But more importantly, you can see the C in the middle of the cloud. All the data that's created inside the cloud will be notarized by us to give it long-term durability and provability. And that then instills some of the trust that Rob was talking about earlier on. So that's effectively why we wanted to collaborate. I haven't really gone into a lot of detail about what we do. If you're interested, you can go on our website, and there's lots there. So the great thing for us was it's a live test environment. If this rolls out, they're going to have to pay us money, so that's good. Once we've got it deployed, it's a reuse case for selling to other applications for Codel, and we're actually working with SWIFT, who are the interbank messaging community for shipping money around the world. So we're doing something similar with them, which is good too. And as I mentioned, we've got other applications for Codel that we would like to see in the cloud at some point. I talked to you about telemedicine, but the electronic health record is a point in question, and also there's an identity application that we're working on. So what's it been like doing this? Kevin will tell you, but it's been remarkably smooth, actually. I thought it was going to be appalling, but it wasn't at all. I don't know whether that's because we're not engaging directly with government, no disrespect to anybody who's from the government here today. But it has been great, and we've met very, very motivated people. It's been quite quick. It was a bit slow to start, but then it speeded up, and actually I've got in my pocket here, Rob, for you to take back with you. This is the Codel component that they're going to actually plug in, hopefully tomorrow, that's going to deliver our service in the cloud. That's, what would we say, that's about a month later than we had expected, but so I can give you that now. Rob, don't lose it. Okay. So it's been good, but after the slow start, it picked up well. The other good thing about it is there are no large companies throwing their weight about. So we don't have to negotiate with the oracles of this world who actually sort of kill you off if they can. So that's been really good. And it's been true collaboration. And I hadn't met Kevin before this project, but he and I are going to work together afterwards. So that's my bit.
Good afternoon, everyone. My name's Kevin Curtis. I'm here to represent Applied Health Intelligence. What's it all about? Well, some background. So we specialise in essentially health economics, which really is understanding the scarcity of resource and how to distribute that in a fair way, I guess. Our parent company is German-based. We have about 80% market share in Germany. And in Germany, we support over 50 million lives on a daily basis. So we determined that we were looking for an opportunity to move into the UK. So part of our drive around joining this cloud initiative was market entry. We were luckily involved at the inception, which is quite a while ago now, and we'd had identified Swansea University, EHI2, the Institute of Life Science, and the Health Informatics Research Unit at the university as being world class. And that was fundamental to our choice of approaching the university and subsequently to become involved in this. We were, I was going to say we were heartened, but a more accurate description is we were shocked that the Welsh Government actually really supported this initiative. And we were shocked at how quickly they responded to our bid documents. And we're really, really pleasantly surprised. We have as you can imagine, we have a steering meeting every month, and representatives from the Welsh Government are there, the funding group, and they are constructive, they're positive, and their attitude is really can do. And so our experience of working with the government, as opposed to James's in that sense, is really positive. And the same could be said of the university. The other things that drive us, as I said earlier, it's a vehicle in which we can significantly reduce the time, cost and risk of market entry. And this is true for anybody who has an application that they want to put on the cloud for the user community to access and give comment upon and feedback, etc. And we do see this becoming a market-level commercial channel for health informatics. Forget the word cloud. It's all this technology mumbo-jumbo. It's software as a service. It's on-demand consumption. And in Germany, we've already seen companies move from a standard commercial model where they pay lots of annual costs to install software to one where they pay transaction costs to consume services. So this is, we believe this is going to happen. And we're very happy to be at the forefront of this in the UK. The other things that drive us now, if I look in retrospect at this, we really do see this as a platform for innovation. And innovation in the sense that it would encourage other SMEs to bring their products forward and have them used and get some feedback and start that incredibly difficult dialogue to achieve where your customer begins to tell you what they like and what they don't like, how it should be shaped, etc. And that's a key part of innovation. And we believe this platform will actually support that in a very solid way. The byproduct of that, of course, is that you have a trusted service. What Rob did not have time to mention is that behind this, there's a lot of governance that goes on. There's a lot of governance about understanding the product that's going onto the cloud, how much clinical risk does it actually represent if it's used. Those sort of areas all have to be gone through and understood before we can actually get new entrants onto the cloud. So it's not just like we're throwing these apps onto a store and saying, yeah, you can use it, see what you think. There's a real defined process that's been agreed with the NHS in Wales to actually define what level of risk these applications represent and how, in fact, the health cloud mitigates those risks. Development of collaborative solutions, very, very important. And access to other markets. Again, I believe that, with the current and future investment in this initiative, other markets will open up because we are moving towards an on-demand consumption model.